If you're over 55, I want you to take a moment and really look at your body, your skin, your nails, your eyes, even your ankles. Because sometimes your body whispers before it screams. See, most people think heart problems always come with chest pain, shortness of breath, or a dramatic heart attack moment. But the truth? Heart disease often begins silently, and your body has been trying to warn you all along. Sometimes it's a small crease on your earlobe. Sometimes it's a faint ring around your iris. Sometimes it's a bit of swelling around your ankles that just doesn't go away. Tiny clues that most of us overlook every single day. Hi, I'm Dr. Michael, and welcome to Vital Health Guide, where we explore the science of aging gracefully and keeping your heart strong for life after 60. In today's video, I'm going to walk you through 13 subtle signs your body gives when your heart needs help, and how modern doctors use them as early red flags before things turn serious. Because here's what I've learned after decades of seeing older patients at my clinic. Your body always tells the truth. You just have to know how to listen. Why so many seniors miss the early warnings. According to the Centers for Disease Control and Prevention, nearly 80% of adults over 60 inches, the U.S., have some form of cardiovascular issue, high blood pressure, stiff arteries, or hidden cholesterol buildup, but over half of them don't even know it. Why? Because the early signs don't usually show up in your chest. They show up on your skin, your eyes, your nails, even your tongue. It's easy to think these are just normal aging, but science says otherwise. Research from Harvard Medical School and the Cleveland Clinic shows that certain skin or nail changes often mirror what's happening deep inside your blood vessels. If your tiny surface vessels are inflamed or stiff, it's often a reflection of what's happening in the arteries that feed your heart. That's why today's video might be one of the most important you'll ever watch, because these signs can appear years before a heart attack ever does. What you'll discover in this video. In the next few minutes, we'll cover 5 visual clues, things you can actually see or feel on your own body that could reveal how healthy your heart really is. Here's a quick peek at what's coming. The swelling in your ankles that tells you your heart may be struggling to pump efficiently. Fluid in the lungs, pulmonary edema, causes shortness of breath when lying down or sleeping flat. The irregular pulse you can detect with your own fingers, something even your smartwatch might already be trying to warn you about. The tiny crease on your earlobe that could point to vascular aging. White ring around the iris, arcus senilis, a sign of cholesterol buildup, especially if seen before age 45. But here's the good news. You're not helpless. You don't need expensive tests to start noticing these things. You just need awareness and a few small lifestyle changes that can dramatically protect your heart. Simple daily habits, like walking 30 minutes a day, cutting down processed sugar, managing stress through slow breathing, and adding omega-3 rich foods like salmon and walnuts can actually improve your circulation and reverse some of the vessel stiffness that leads to these changes. In fact, the National Institute on Aging says that regular movement and a heart-healthy diet can lower the risk of heart failure by up to 40%, even for people in their 70s. So as we go through these 13 signs, remember this isn't about fear. It's about awareness, empowerment, and prevention. What's next? In Part 2, we'll begin with one of the most surprising signs of all, a tiny diagonal crease on your earlobe that researchers have linked to early vascular aging. We'll explore what it looks like, what it means for your heart, and when it's time to talk to your doctor. Because sometimes, protecting your heart starts with something as small as a line you never noticed before. So take a deep breath, keep an open mind, and let's look at what your body might be trying to tell you. The subtle clues your body gives about heart health. Let's start with something you'd probably never think to connect with your heart. Your earlobes. Frank's sign, the earlobe crease that speaks volumes. If you've ever noticed a diagonal crease running across one or both of your earlobes, almost like a tiny wrinkle that doesn't go away, that might not just be a sign of aging. Doctors call this Frank's sign, named after Dr. Sanders Frank, who first described it in the 1970 seconds. Back then, most experts dismissed it as coincidence. But over the years, study after study, including one from Harvard Medical School, found that people with deep earlobe creases were significantly more likely to have blocked or stiff arteries. Why? Because your earlobe is a micromap of your vascular system. It has no fat, just tiny blood vessels. When those vessels lose flexibility or start to stiffen, a process called vascular aging, the skin above them can fold or crease prematurely. And here's the key. If your small vessels are aging faster than they should, chances are your larger ones, the ones feeding your heart, might be too. Now, does that mean every crease equals heart disease? Of course not. It's more like a conversation starter with your doctor, not a diagnosis. If you're over 55 and see a clear crease on both earlobes, it's worth a simple checkup and a cholesterol test. Pro tip: the same things that age your skin, sun damage, smoking, chronic stress, also age your arteries. Protecting your skin can actually protect your heart. The white ring around your iris arcus senilis. Take a close look in the mirror, or ask a loved one to look at your eyes. Do you see a grayish-white ring around your iris, the colored part? That's called arcus senilis, and it's surprisingly common. Almost everyone develops it eventually. It's basically tiny cholesterol deposits at the edge of the cornea. If you're over 60, it's usually harmless, just a sign of aging. But here's the catch. If you see that white ring before age 45, it can signal high cholesterol or early arterial plaque buildup. The Cleveland Clinic calls this an early cardiovascular yellow light. Not yet danger, but time to slow down and check your numbers. Small lifestyle upgrade. Even if your cholesterol is borderline, you can help clear your arteries naturally by eating more fiber-rich foods like oats, chia seeds, and lentils, adding omega-3 seconds from salmon, sardines, or walnuts, walking after meals. Studies show even a 10-minute walk helps lower post-meal blood fats. Drinking enough water. Dehydration thickens your blood and makes your heart work harder. Swollen ankles or feet when the heart falls behind. Next, let's look downward at your ankles and feet. Notice if they swell by the end of the day, leaving a soft indentation when you press your finger against them. Doctors call this pitting edema, and it's one of the most visible signs of heart failure. Now, heart failure sounds frightening, but it doesn't mean your heart has stopped. It means your heart isn't pumping blood as efficiently as it should. When that happens, blood starts backing up first in your veins, then into the tissues. The result? Fluid accumulation in your lower legs, ankles, or sometimes even your belly. How to check at home? Press firmly on your shin bone or ankle for about 5 to 10 seconds. If a dent remains, that's pitting edema. If it's just mild and goes away after rest, it might be from standing too long or salt intake. But if it's persistent or worsening, it's worth checking your heart and kidneys. According to the American Heart Association, nearly 6 million Americans live with some stage of heart failure, and most cases start subtly. Good news. Gentle walking, reducing salt, wearing compression socks, and elevating your legs can help a lot. And small nutrition changes like potassium-rich foods, bananas, spinach, beans, can balance fluid levels naturally. When the lungs fill with fluid, pulmonary edema, sometimes that same fluid buildup travels upward into your lungs. Doctors call it pulmonary edema, and it can make it hard to breathe, especially when you lie flat. If you've ever noticed that you sleep better in a recliner or wake up short of breath at night, this could be your heart quietly asking for help. In the hospital, cardiologists often see dramatic recoveries when that excess fluid is removed. Using gentle diuretics or water pills, some patients can lose 10 to 20 pounds of fluid in just a few days, relieving that heavy pressure almost instantly. It's one of the most rewarding transformations in medicine, watching someone breathe freely again. The pulse that predicts stroke, atrial fibrillation. Finally, let's talk about your heartbeat. Right now, You can check it yourself. Place 2 fingers on your wrist or neck. Feel that rhythm. Is it steady like a clock or random and unpredictable? If it feels irregular like thump, pause, thump, thump, pause, that could be atrial fibrillation or AFib. It's one of the most common arrhythmias after age 60. In AFib, the upper chambers of your heart, the atria, stop contracting and sink. They just flutter, sending chaotic signals. That makes your heartbeat irregular and sometimes causes dizziness, fatigue, or shortness of breath. But the real danger is that blood can pool and form clots inside the heart. If a clot travels to your brain, it can cause a stroke. The National Institutes of Health estimate that 1 in 6 strokes in older adults comes from untreated atrial fibrillation. Protective step. If you or your smartwatch ever detects an irregular pulse, don't ignore it. A simple ECG can confirm AFib, and blood-thinning medications can dramatically reduce your stroke risk. Even light daily exercise and cutting back on caffeine or alcohol can help restore rhythm naturally over time. Let me share a quick story that always moves me. A man named George, 68, came into my clinic 2 years ago. He was tired, short of breath, and had swelling in both legs. He thought it was just getting old. But one small observation changed everything. His wife noticed. His nails had faint reddish streaks. We tested him, and sure enough, he had early endocarditis, an infection quietly damaging his heart valve. Catching it early meant we could treat it with antibiotics instead of surgery. 6 months later, George told me, "I feel younger now than I did at 60. He started walking every morning, eating oatmeal with walnuts, and laughing more often. That's the magic of awareness. It turns fear into power. Why early detection matters. Most people believe heart disease just happens one day, but science tells a different story. It's a slow buildup, often over years or decades. By the time chest pain shows up, the arteries have usually been narrowing for a long time. That's why the National Institute on Aging emphasizes early lifestyle changes as the best medicine. Quit smoking, your arteries start healing within weeks. Cut back on added sugar and trans fats. Make movement as automatic as brushing your teeth. The earlier you act, the more your body rewards you with clearer thinking, better sleep, steadier energy, and yes, a stronger heart. Aging gracefully, one beat at a time. Here's something I tell every patient over 60. Aging doesn't weaken your heart, neglect does. Your heart has been beating over 100,000 times a day for your entire life. That's more than 2.5 billion beats if you've reached 70. So even if you've faced high blood pressure, cholesterol, or surgery, you're still here because your heart has been fighting for you every single day. Maybe it's time we start fighting for it too. So, make today the day you start listening, really listening to what your body's been trying to tell you. A thought to leave you with. You can't stop aging, but you can slow it down and even reverse some of its effects, one wise habit at a time. Your body isn't betraying you, it's communicating with you. And every beat of your heart is a reminder that it's never too late to start healing. So here's my question for you. Which of these signs surprised you the most? And what's one change you'll start today to protect your heart? I'd love to hear your thoughts in the comments. And if this video helped you understand your body just a little better, please give it a thumbs up, subscribe, and turn on notifications for more trusted, science-backed health secrets for life after 60. Until next time, stay curious, stay kind, and keep your heart strong.